And should there be a power outage, something goes wrong, the guy isn't performing well on the ventilator, you can take it off and you can use an ambu bag and hand bag it. It is effective. It isn't second best. We found that it's just as effective as a machine. It's just that you don't have to have someone standing there doing it all the time. If you're transporting a patient between the ICU and down for some CT or something, the machine gets pushed down with you, but all the way there, you're bagging him. It doesn't work in the elevator. It has to be plugged in. So if you question anything, that something's wrong with the patient, he's getting restless, he's sounding bad, you've suctioned, it's not doing any good, you've repositioned, it's not doing any good, take him off the ventilator and start hand bagging him and call the doc and the RT and see what's going on. These bags are now all disposable. They're all over the place. They're at the head of every bed. Some of them they're all kind of folded up together. If you've got a patient who may need an ambu bag, you open it up. You don't leave it hanging in the little pre-packaging. If you've got the chance that somebody's going to need it, it means you need to have it ready to go. So the ambu bag, if you didn't have an endotracheal tube, there's a mask that can go on, and you hold it. Now at this height, I don't hold it, but the mask goes on. And
it's one of those one-way valve masks. You know, it goes like this, and there's one that goes.
Hold his head up. If you're going to have to bag without an endotracheal tube, you really need him flat to do that because you've got to hold his airway up. Hold with one hand, hold the mask, hold his airway up, and breathe for the other. To ventilate this guy, it comes off. Where I just took it off. There. This is his suction. This is what the RT is going to change out for you. This is the endotracheal tube and what it looks like when it's in him. Just next to this. And you can breathe. How fast do you go? How many times a minute?
What's your BLS at? Whoever have taken BLS.
Well, it's every 30 compressions and 2 breaths.
And
so
we could do it within a minute. So then it's about 5 to 6 a minute.
6 to 12, well, is perfectly normal for people. If you're out walking around, your respiratory rate's probably around 16, maybe 18. Doesn't have to be that fast, but 6 to 8 will do it for him. And depending on the size of the person, there's very few people that you have to go that way. It just looks really good on television when they do it. That will expand his lungs. And if you don't believe me sometime, just put your stethoscope and listen to where you hear air sounds when you just push it a little bit.
And is it connected to oxygen?
It's connected to oxygen through up there into that. But if you don't have oxygen available, you can bag them on room air. What % of oxygen's in room air that everybody's breathing?
21.
It's 21. Mark her down for today. 21.
Yeah. And it's, you don't have to squeeze it. I mean, right now ACLS and BLS is just really halfway. You don't have to hyperinflate the lungs or the stomach.
So anybody can use it, and it's effective. Here back on his ventilator. What am I?